So my signature assignment study is on chronic traumatic encephalopathy, CTE. Um, CTE is a part of the brain that has been damaged or altered due to a traumatic brain injury during contact sports or any other activity that involved hitting your head or collision with anything in particular. So, for the first time in 80 years, there's a need for research on the public health issue of CTE because it's becomingly more common in former athletes as well as military personnel, in which they have in common of contact trauma within the head. Athletes during games and sports, and military personnel during explosive blasts during the battle. Until recently, known cases of CTE were only prevalent among boxers, in which they get hit in the head during fights and for a very long period of time. This, because of the new CTE, such a new topic, this study explored the confirmed cases of CTE in which the pathogenesis of the brain results in different signs and symptoms, early versus late stages. So the method they use is a quantitative research exploring clinical presentations, and they interviewed 36 adult males, from which all cases of neuropathologically confirmed CTE were first determined. And this study was done in Boston University Center. Subjects were not aware that they were being interviewed to find neuropathic signs and symptoms of CTE, which makes this study even more liable because of that. Because sometimes you tend to change, or the fact that it's for a cause, the results tends to be manipulated in that way. So that's a good thing that the study did that. And also, qualifications of the study were that no comorbid neurodegenerative or motor neuron disease of the brain were found in these 36 subjects, because it might manipulate the results or the purpose of the study that we're trying to do, which is mainly just confirm cases of CTE. So no comorbid brain disease among the subjects. In the manipulation of the study, we do these things enable for us to strengthen the results, in which true experimental studies are considered the highest level when we are able to control these dependent variables. And that's what Stern and et al. Did during this study. There's three results showing cognitive, behavioral, and mood impairments. So in the early stages, you'll find behavioral and mood impairments in which depression is found, impulsivity, anger, not being able to control your feelings. Those are the behavioral and mood changes that we're talking about. And then in the late stages, it's more a cognitive impairment, in which you'll see more of like a progressive disease, such as dementia. We all know dementia. And then Alzheimer's disease, in which memory alters our ability to function on a daily basis. Those are the later stages. So again, early stages, behavioral, mood changes, and then late stages, progressive disease such as dementia and Alzheimer's. So, as reported earlier, boxers with CTE find these two obvious clinical manifestation from early to late, and it is confirmed in these cases because often CTE is not detected through MRI or a CT scan. This is because of the extent of which in the brain it affects. That's why it's such a new study, because scientists go off of what they see, and they don't often see CTE in these cases and able for them to diagnose it. So knowing the signs and symptoms, it's so important, and it's so important that if you are one of those high risk population in which your job requires you to have multiple injuries in the brain, I would suggest to go get help and go to your doctor and just make sure that nothing in this case is happening, because certain cases, the extent of the situation could even further into death, so which I'll be talking about later. The limitation of the study, though, however, is pretty much overall sample size. It is small, so we need to caution that generalizing these results in a larger population is not really reliable in that way. And also, there's a little bit of inherent selection bias with the imposed post-mortem brain selection donated for the study. And in the brain bank, they only selected smaller sample because they had to eliminate the individuals with comorbid pathology and only select brains that were athletes or those that involved in the criteria of the subjects we were looking for. So this restricted the further ability to generalize our findings, which kind of goes against what a quantitative study is, because we want to go from a general to more specific findings. So that is the limitation of this study. I guess in the near future, for the study, they could probably assess more larger sample in a larger population and have it be a sufficient amount of sources in which we could evaluate CTE in a bigger picture. So CTE in a population, like I said, it's so important to identify signs and symptoms because they're not detected in CT scans and MRIs that you normally would do at a doctor's visit. So Stern et al. Did this study, enable for the people that might have these symptoms to go get help. So symptoms acknowledge the higher population, enable to attempt a better prognosis, in which we could which part of epidemiology is to be informed of the disease and find ways to either prevent or find better prognosis and treatments for the disease. So why am I talking about this specific study? I like this study because it identified a gap of knowledge in which we're all new to, which is CTE. And I feel like it's becoming a common problem and a recent controversial issues among the population with CTE, is that they're finding that the athletes or these subjects were later found dead due to suicidal tendencies. So, like I mentioned earlier, behavioral and mood changes involve depression, and sometimes the extent of depression is not treated right away and can result into suicide. And it's really devastating to hear that such a new disease could be so terrifying like that you don't even know that it's there, and next thing you know you're having these feelings and you don't know why you're getting these feelings. So I thought that was very interesting. So exploring the factors and assessing CTE through clinical manifestation that otherwise would not be found in the MRI scan, it's so valuable to the public health community. And we do these things to acknowledge new diseases and possibly do research to identify the risk factors, the medical diagnostic, and the reliable signs and symptoms that confirm the diagnosis. And that is my thoughts and review on a study on CTE. Thank you.